In this video, we are going to talk about liver. Puneet, not this one. What is liver? It is an organ. Only organ? No. It is the largest organ. It has a role in processing, detoxification, and storaging. Liver is vital. It removes toxin, convert food into energy, make essential proteins and clotting factors. It produces bile for digestion. But sometimes this powerhouse get inflamed or injured. This condition is known as hepatitis. Hepatitis just means inflammation of the liver. It can be caused by virus, alcohol, drugs, and other toxin. When it happens, the liver's ability to do its job is disrupted.
To check the functioning of liver, some tests are being performed. The first one is bilirubin test. Bilirubin is a breakdown product of hemoglobin. RBC has a lifespan of 120 days. Further, it breaks down and forms hemoglobin. Hemoglobin has two components, the heme part and the globin part. Heme part has been converted into biliverdin and then has been converted into the unconjugated form bilirubin. And then upon the conjugation of albumin, it forms bilirubin conjugated form in the liver itself, and that is excreted in the urine and feces. But what reason could be there for the elevation of bilirubin? The first one is hemolysis, second one is the failure of conjugating of albumin protein, and the third one is the obstruction in the biliary system. The second test is AST test, aspartate aminotransferase test. Earlier used to be called serum glutamate oxaloacetate transaminase. This enzyme is high in heart muscle, liver and skeletal muscle, but it is very low in kidney and pancreas. Damaged tissue releases this enzyme, so the elevation of this enzyme in the blood clearly determines the extent of cellular damage. After the cellular damage, it gets elevated after 8 hours. Peak level is 2 to 3 days and becomes normal after 4 to 7 days. The major reason of the elevation of this enzyme is chronic hepatocellular disease, acute hepatitis, cirrhosis, acute extrahepatic obstruction, etc. The third test is alanine aminotransferase test, also known as the ALT test. Earlier, it used to be called the serum glutamate pyruvate transaminase. This enzyme is primarily found in the liver, and it can also be found in heart, kidney, and blood, but it is in very less quantity. The liver injury elevates the level of this enzyme. One can determine by the elevation of this enzyme that liver is not functioning as it should. Main reason of this elevation is hepatic cancer, chronic cirrhosis, hepatitis, and chronic alcoholism.
Hence, liver function tests help assess the extent of liver injury in hepatitis. Elevated enzymes such as ALT and AST indicate liver inflammation, while bilirubin and albumin levels reflect liver function. Proper dietary interventions, including adequate calories, protein, vitamins, and avoidance of alcohol and hepatotoxic substances, support liver recovery. And in acute hepatitis, a balanced diet with rest is essential, whereas in chronic hepatitis, long term nutritional management helps prevent complications and maintain liver health.